I'm Renee. I'm a 7th semester nursing student. It's September 16th at 10 a.m. and I'm going to be demonstrating how to insert an NG tube. So before I go into the patient's room, I'm going to be checking his chart for a history of nasal surgery, deviated septum, make sure his mental status is okay, and that he's alert and oriented and he's going to cooperate with me. And then I'm going to check the doctor's order and make sure I've got the right size of NG tube and make sure that it's not expired. Hi, Mr. Jones. I'm Renee. I'm your nursing student. Can you tell me your name and date of birth? Good. So I'm going to be inserting an NG tube that the doctor has ordered for you. It's going to be inserted in your nose and it's going to go down to your stomach. So I'm going to put him into high Fowler's position. I'm going to assess his Mayers. I'm going to occlude one nostril and have him breathe out of the other and do the same on the other side. Good. So I'm going to be inserting the NG tube into his right nostril. Now I'm going to measure how far I am inserting the NG tube. So I'm going to be measuring from the tip of his nose to the tip of his ear down to the xiphoid process. Okay. And then I'm going to tape that. And then I'm going to prepare the rest of my tape. My bedside table has already been cleaned. Alright, I'm going to get my pH strips ready. And then I'm going to lubricate the tip of the NG tube 4 inches. Okay, Mr. Jones, can you extend your head back for me and take deep breaths? Okay, once he starts coughing and I think I've hit the oropharynx, I'm going to have him start to take small sips of water. And bend your head forward for me, Mr. Jones. And then I'm going to rotate the tube 180 degrees. And now I'm going to temporarily tape the NG tube to his face. Alright, make sure it's clamped. And now I'm going to check for placement, which I'm going to do by testing the pH and inserting air. You can also check for placement by X-ray. Okay. And now I'm going to get my air ready. It needs to be 10 to 30 mils. All right. Okay, now that I know it's in the right place, I'm going to securely tape the NG tube to his nose. If his nose was oily, I would wipe off his nose with alcohol. Okay, and now I'm going to tape the tube to his shirt. And get him comfortable. And at this point, I would set him up to suction or up to his feeding, but right now he is clamped. And then I would document how the insertion went and how much drainage he had and all other relevant data.